Well, I'm really very, very interested in speaking with our guest today, Ken Tai. And I am glad that you are watching another Zigzag for Zero audio recording. Today, we're going to be speaking about the intersection of safety and pharmacy. And what's relevant in today's current events is COVID is starting to see some up spikes in several states around the United States, as well as around the rest of the world. But other places are starting to see complete drops. And simultaneously, there is a lot of upheaval and an uprising, recognizing the embedded racism that this nation has struggled with for many, many years. Certainly that's not a new thing, but we're addressing it in some new upsurged ways as well right now. My guest today, Ken Tai, represents two organizations. He is the founder and CEO of an organization called 986 Pharmacy, and they are serving several communities in the state of California and a couple in Texas and Nevada as well. And their goal is to keep the human temperature at 98.6. And Ken, in a minute, I'll ask you if that really is about just keeping them healthy, or I'd like to hear a little bit more about that name. It's very catchy. Ken also is the current
Absolutely.
president. Thank you. He's also the current president of the California Pharmacists Association. And I want to thank my friend and colleague, Ron Jordan, for introducing us and suggesting that this program acknowledge and speak with pharmacists. Many people don't really understand the way in which pharmacists really do support safety in medical care. And today we're going to focus our attention in that area. So Ken, thank you very much for being here. I appreciate it.
Well, Vonda, thank you very much for having me. It's very exciting to be in your program.
Great. Well, I'd like to get started by asking you about 98.6. You're the founder. I take it you're sort of the inspiration. Can you tell us a little bit about the name of 98.6 and what is meant by that?
Well, actually, I think you figured it out. 98.6 is obviously a normal body temperature. The interesting thing is that it has changed since our starting of this company, and it's been lowered slightly, but still we kind of keep up with that name. And the thought process is pretty simple. We want to make sure that all the patients that we serve and the communities that we are a part of, that we keep everyone healthy, right
Mhm.
perfectly at 98.6 degrees. Obviously, as we all know, during these times of COVID, if your temperature is elevated and you have fevers, then that's not a good thing. That means you might, be fighting an infection or maybe some other conditions. And of course, you're too low, you're hypothermic, which is not a good thing as well. So, our goal is simple, is to make sure that we take care of our patients and keep them at the normal body temperature.
So in that role of looking at the pharmacist, I'm going to give a brief story because pharmacists I think saved my, not saved my life so much several years ago, but saved my quality of life, to be sure. I had been having migraine headaches for many, many years. I had gone to several different doctors. I had worked every angle I could possibly think of, and I continued to have the pain. And I was picking up a prescription from a pharmacist one day, another possible improvement for this pain I was experiencing. And the pharmacist looked at me and she said, "Have you ever tried a combination of Tylenol and ibuprofen?" And I said, "No, no one's ever suggested any such thing." And she says, you might just want to try it. A lot of people do get some benefit from taking that combination. And she also schooled me about some combinations that didn't work, certain things I should not take together. And it was just a very informative over the counter experience. I picked up a bottle of each. I took it home. I took, I think, two of each. And within 20 minutes, my migraine was gone. And that was about 16 years ago. And it is still today, when I get a migraine, that's my magic sauce. So I want you to just tell us about the role of pharmacy, and not just only the safety of our lives, but also just the quality of our lives. You got into this business for a reason, I assume, and you started your business. Tell us a little bit about why that's important to you, and the role that you think pharmacy has in the medical and safety arena.
Yeah, and thank you for that story because that is a perfect illustration of what pharmacists in the community are doing every single day. I think that we are a very accessible resource. I think we're highly educated. I mean, most pharmacists, I don't even know if a lot of folks know, they usually have a 4-year doctorate degree on top of their undergraduate degree. So they obviously come with a lot of knowledge and understanding of medications. We are definitely the medication specialist. And because there is technically 60,000 plus pharmacies in the whole United States, there's practically one at every corner that you can go and
Hmm.
get access to speak with, a well-educated and, of course, a professional that can address a lot of medical questions that you might think are maybe just, like you said, very casual type questions, but they make a huge difference in terms of, number one, providing access, but number two, to improve the quality of lives for the patients that are, we're servicing in the community. And, these are just little anecdotal stories, but I can't tell you how many I've experienced as a community pharmacist out there helping my patients. And, these are the little things that make a big difference because we do know that as a healthcare team, whether it's a physician, a PA, a nurse, or whatnot, we're all working together, but we all have our own areas of expertise. And sometimes it's difficult to spend 10 to 15 minutes or whatnot, talking to one of your providers because they're so inundated with all these patients, right? Primary care is just getting, our healthcare system is obviously getting extremely overloaded. And so, to have various professionals in areas where they are an expert in really helps to spread out some of that need for medical care. And of course, that's on top of a lot of things that we do, whether it's checking for interactions, right, on prescriptions that are prescribed. Some patients obviously don't necessarily just go to one pharmacy, they go to multiple pharmacies potentially. And so there's interactions, medications that might have allergic reactions that you might be aware of, and just checking profiles and side effects and just serving as that educational role right to the
Hmm.
community.
Hmm. I was just on a doctor's appointment yesterday on behalf of a friend taking notes, and of course it's on video now because so many appointments that can be are for the family. The patient was with the doctor, and we were talking about, trying to refresh the medication list. And sometimes the pharmacist is in that role of having the opportunity to refresh it, take the things off that no longer need to be there,
Yes.
or as I think you pointed out, the taking away duplications, but also helping in terms of budgeting and finding maybe lower cost options those are available. I'd like to, Ken, if we could turn a little bit to COVID, because I think there are some very interesting developments taking place right now, especially around immunizations and testing. Tell us a little bit about where you see pharmacy helping improve the safety of lives today in this very, very other than usual environment of a virus and pandemic around the world.
Yeah, and thank you for that. And I do think that COVID, you know, uh, obviously as the president of the California Pharmacy Association, we formed a actual COVID task force, and that task force actually focused on a lot of the, oh, the top two main issues that you just discussed, which is testing and of course the vaccinations. And I think these are two very critical components that are going to be necessary for us to hopefully bend or slow the curve, so to speak. And testing, number one, is very key, right? We all know that if we don't know whether or not we have it, that creates a lot of problems, not just from the standpoint of health, but also from the standpoint of being able to go back to work or being able to be reintroduced to your community or the patients and the family members and whatnot that you work around. So um, with all the pharmacies that are out there, if pharmacists can serve as an active participant in that testing process, think of how much more access we can have. Right now, a lot of
Mhm.
folks are going to testing sites, but they're limited, right? And they're also getting extremely overwhelmed.
Yeah.
But if we can spread that out to all the pharmacies, like I mentioned, over 60,000 community pharmacies out there, imagine how much easier it will be. And not to mention the comfort level of patients and community members, right? They are used to going to a pharmacy, so if they go back in there to get a quick test, um, it just makes it so much quicker and accessible for those out there. And I think it'll obviously help towards getting us, back to some level of normalcy and introducing everyone back into society. The
Mhm.
good thing is HHS, which is Human Health Services, along with state and federal governance has issued out an order to say that all pharmacists now can test, which is a
Okay.
huge, huge step. And that was a few weeks ago. I really wish it would have happened a little earlier,
Yeah.
but hey, better late than never. And of course, that's all sort of happening as we speak now. Now, on the vaccination front, pharmacists, at least for the last 15 to 20 years, have been a major force in vaccinating patients, right? To make sure that, whether it's the flu or whether it's hepatitis or influenza, I mean, sorry, or uh, any of the other countless other current disease states out there that require the vaccinations, we have helped to really change that entire projection, right? Um, Even the CDC now has a pharmacist on board because
Hmm.
they recognize how important it is to uh, give that access. You don't even have to have an appointment. You can walk into a pharmacy and literally get your flu shot like that within 5-10 minutes and get out, right? And I think convenience is a very critical and important factor when you look at vaccination rates. And as a matter of fact, we just issued a current statement from our association and CC as well that says that vaccinations really need to get back up to its normal levels, because due to COVID, a lot of folks have not gone back out to get their vaccinations, and now some of the other potential infections might now be at rise because of the fact that we have not been up to speed with all our vaccinations. Of course, that's not even
Interesting.
talking about COVID. So
Right.
we're just trying to position ourselves as a profession to be that access point. And when this vaccine, and I heard recently there was probably 3 of them that are kind of in a horse race now to get their product available, and they're already in phase 3 clinical trials, where hopefully by the beginning of 2021 we will have a vaccine available. And of course, all healthcare providers, including pharmacists, will be ready to go to vaccinate everyone and to hopefully get us all protected from this
Hmm.
current situation.
Fascinating. You hadn't thought about that delayed care of vaccinations. I had certainly heard about delayed care in other regards, but I don't think
Yeah.
that's something that was on my radar. I have two last questions for you, and the first one's a big one. So I know we're not going to be able to really go very far into this topic, but I do want to make sure that people understand, especially many of the people who are listening to these broadcasts are just everyday people. They're not in the field of patient safety or even medicine. Maybe they're supporting someone. They might go to the doctor every once in a while. I'd really like for you to speak very briefly from the California Pharmacists Association and all the associations across the United States. Most states have an association like that. The pharmacists that we think of when we go to the store and we're picking up our medications or we're having a conversation about our uh, prescription that's been given, that's one aspect of pharmacy, but most people don't realize that there's also pharmacies built into hospital systems and healthcare systems and things of that nature. And one of the reasons that I know that people don't know that is that I didn't know that when my husband was in the hospital for 13 days in 2012. And you may or may not know this, Ken. I presume you might have seen that, but my husband died from a hospital-associated venous thromboembolism. And when I followed up with the hospital a few years later to say, what have you done to help make sure that what happened to my husband did not is not happening to others. One of the first things that they pointed to, and my friends at Johns Hopkins also point to pharmacy, the pharmacist has a very key role in noticing when there's a prescription given and it's not taken, or a prescription should be given and it isn't. And so, would you just speak briefly to that to educate this audience a little bit about the role that pharmacy plays in the hospital or other healthcare situations like that?
Yeah, absolutely. And thank you for pointing that out. I mean, it's amazing that, I think in general, like you said, the public really just views pharmacists as, oh, that's the guy over at, a particular chain pharmacy or the corner, independent pharmacy. But you're absolutely right. I mean, we're everywhere, right? We're in the hospitals. We're definitely in other settings such as long-term care, where we work for the VA and ambulatory care, where we actually see patients every day and not fill prescriptions, and we actually go through medications and sort them out. And like you alluded to, we look at, hey, what's missing in terms of this patient's profile. We look at the labs, right, to make sure the doses are adequate, or maybe is there duplication, or maybe is this one medication, even though it's maybe solving one particular health issue might be causing side effects that are creating other issues that will create and compound, creating more medication needs, right? And believe it or not, as pharmacists, we really want to minimize how much you take in terms of medication and not maximize it. And of course, we're working very closely with other healthcare providers, like physicians, nurses, PAs, and whatnot, to discuss these different things. And in the hospital, we actually round with the doctors, going through in the morning to see the patients and then looking at their medications. And they actually, as a team member, as healthcare team member, we talk amongst ourselves, say, hey, what, this is the dose they're on, but maybe their kidney or liver function is not up to speed. How do we make a dose adjustments? And believe it or not, a lot of those are completely under the jurisdiction of a pharmacist. They actually look at that. They DC, I'm using medical terminology. We discontinue orders all the time. We start orders all the time. We're constantly recommending changes to orders all the time. And yeah, I mean, absolutely. I think that even though we're sort of behind the scenes and you don't get to see us too often and you just see a bunch of folks in white coats, one of those might be a pharmacist. And of course, everyone refers each other as doctor this, doctor that, because we all have doctorate's degrees. So it makes it even more complicated and confusing. But we're definitely there. You can trust that all hospitals do have a pharmacy, maybe sometimes hidden in the basement, but they're there. And that the pharmacists are definitely working alongside with all the other healthcare providers to make sure that the patient gets the best care possible. Now, of course, we're not perfect, and things do happen, within the healthcare team. But I think as a team working together, the ability for you to maximize outcomes and to help patients are so much more improved. And I think that's sort of the spirit of us as a whole, not just pharmacists, but just healthcare providers.
That's a really good segue into the last question that I would like to ask. And the segue is this, that, sometimes things don't go according to plan. We know that mistakes and errors do happen in medicine every day. And for me, in my perspective, and I know this is true for many of the people who have dedicated their attention to improving safety in medical care, the delivery of medical care, you know, it's one thing to make a mistake. It's another thing to not learn from that mistake and then attempt to have that decrease or that error decrease in its occurrence. What do you speak, how do you speak about that with your loved ones, friends, family members? What role do you think there has to play in terms of just public education and the things that we can do to be in partnership with our medical care providers to help minimize those errors, but also that when those errors do happen, we are doing our best to keep them from happening again?
Yeah, and I think that the key thing that you said there is just to, keep them from happening again. I think that's really, really critical. And I think there's so many different steps that have been implemented within the profession to ensure, I mean, to be honest, I mean, I think even pharmacists were implemented as a step to prevent error, right? Because
Mm.
previously it was physicians writing prescriptions and they would fill them and there it goes. But as our health system evolved, they're like, well, wait, just like anyone else, any healthcare provider is subject to potential errors, right? A physician might make an error, a nurse, PA, anybody, right? Pharmacist. And so let's have someone that maybe it's a little more, has a little more education in the area of these medications now serve as a check, another additional check to ensure that the patients are getting the medications they're supposed to get and that there's no additional side effects, interactions, allergic reactions or whatnot that should be screened prior
Mhm.
to event, ultimately getting into the patient's hands. And I think that that's sort of, some people even call the pharmacists the gatekeepers, right, prior
Mhm.
to patients getting their final medications. But I've always felt that that is a responsibility, not necessarily for the pharmacist, but for everybody, whether it's a healthcare provider. And you talked, very specifically about family members and the patients themselves. We have to ultimately take responsibility for everything that we do, right? We have all these people that help us, whether it's the physician, the healthcare team, the doctors, the pharmacists, but we still need to ask questions when we get medications or when we go see a physician, a diagnosis, we need to ask questions. Hey, is this right for me? I've taken this medication, but I had this type of, that's how I felt. These are the, potential side effects that I've noticed. is this medication related? Is it something that I can do about that, right?
Mhm.
When you get medications, don't just go, okay, well, it's one twice a day. Let me go ahead and take this, and not worry about that. Do I need to take this with food? Should I take this by itself? Should I, maybe avoid taking this with other medications? Um, some people even honestly don't even think that taking vitamins is potentially an effect, right, on
Mhm.
interactions, and they'll come in, saying that, oh, I take all these, they're all just over the counter, Tylenol and ibuprofen, not knowing that that might also play a part into the medication in terms of interactions and overdosing, right? You
Mhm.
talked about Tylenol, and it's as great as a drug as it is in terms of being able to help us. Anything in life could help or hurt you, right? Too
Sure.
much of Tylenol is also a major problem, but in the right and appropriate amounts, then it could be a miracle drug. Right.
Yeah.
So I think that ultimately there has been a lot of checks placed on pharmacists to ensure that we do our jobs. But I always say that it's a job. This is, ensuring patient safety is really something that is important for everybody, to be aware of, and even, a patient, or if they're comfortable sharing that with their families, to make sure that it's something that everyone talks about and understands, because sometimes something might be happening to you and you might not even notice it, and it might be your significant other, or the children, or your family members, parents, that actually point out, or friends that say, lately you've not been the same,
Yeah.
what's wrong, and those are the things that start giving you cues, right? And again, even though things do happen, how do we minimize the effects and collateral damage of that, and of course ensuring that that doesn't happen again.
Yeah.
And I think those are very key, and if we keep on honing in that, eventually it'll be hopefully minimized to a point where we don't have to worry as much,
Mhm.
about, definitely, if it happens to one person, that it won't happen again to someone else, as unfortunate as it is for the unfortunate for the initial patient, right?
Thank you.
But it's a work in progress.
Yeah, it is. We have a long road to go, and I feel, very committed to making sure that we keep people apprised of the developments that are happening, but also, I call upon people to speak up and really raise those issues when they see them, even family members of patients. Ken, thank you so much for being uh, a- attentive to this and the time that it took. I know there's a lot going on right now, and where a lot of people are zoomed out or videoed
Yes.
out, but you took the time to be here to help educate people today. I really appreciate that, and I hope maybe if I have more questions, I might be able to call on you again someday.
Anytime, and Vonna, thank you so much for what you do. I think that, you might say people are zoomed out, but the reality is that we're a society that craves more information and knowledge, and
It's true.
yeah, and what you have here on this platform is a great way to allow more people to know what's going on and hopefully get some answers. So I think that everyone really appreciates it.
Thank you, and thanks for taking time to listen to this interview with Ken Tai today. And I hope you have a very good day.